with inspection first. We do an inspection of the gastrointestinal area. We're looking for abdominal distension. We also look for just an even distribution of the skin tone and the skin color. We also look for any venous processes or any veins that may be protruding under the skin as well. None of that is noted. Once we do a full inspection, also looking for any scars or any bruising or wounds, anything that may indicate there's been any previous abdominal procedures done. Once we move past the inspection, then we will move to the auscultation, as we want to auscultate the area before we do any percussion or palpation to do any maneuvering to the organs. With auscultation, we start with our stethoscope by listening in the right lower quadrant. We're listening for bowel sounds here. We start in the right lower, and then we move in a clockwise direction, moving to the right upper, and then left lower when we listen to the bowel sounds. And we can listen in each area for a full minute, and we're listening for the bowel sounds to be hyperactive, hypoactive, and also just to make sure that they are actually present. Once we listen to the bowel sounds in all 4 quadrants, we can then listen for friction rubs. We'll listen for our friction rubs in the upper abdominal area, and then we can listen for bruits. We would actually listen for the bruits with the bell of the stethoscope. Don't have one on this stethoscope, so for those purposes we'll identify the area, but you would do that with a bell when you listen to your bruits. And you listen, and a bruit is going to be a swishing type sound, and this is abnormal to hear when you auscultate. And once we listen for bruits, we're done with our auscultation. Then we can move on to our percussion. With percussion, we will place finger on the abdominal area, and then we tap that with our dominant hand. And then we're listening here for any tympany, any hyperresonance, or dullness. Again, you would hear the dullness over the organs. Once we do our percussion, then we can move on to palpation. With palpation, we would start with a light palpation. Here we're feeling for any tenderness or rigidity, and then we would move on to a deeper palpation where we would be feeling for any masses or lumps in the abdominal area. And then once we palpate those areas, then we can palpate our kidney. We shin to the back and down here. And also for the liver, take a deep breath in and hold it. Sometimes you can feel the borders of the liver. Here I can't palpate. On our left side, we would feel for our spleen. Take a deep breath in and hold it. Okay. And then we can feel for our liver as well. I'm sorry, kidney. And this concludes our gastrointestinal assessment.